Audio Jungle.
Now, beyond speaking to you and examining you and doing a chest x-ray, your doctor may also request more specific tests to confirm the diagnosis of asthma. And these include checking your exhaled breath for the presence of nitric oxide, a chemical that can be elevated in your exhaled breath if you have asthma. There is also something called a peak expiratory flow meter. Flow reading using a peak expiratory flow meter, and they may ask you to record this over a period of 2 to 4 weeks in the morning and in the evenings, and what your doctor will be looking for is to see whether there's any variability, so difference in the changes between your readings over that period of time, and a variability of 20% or more is significant. They may also require you to do something called a spirometry. This is a more detailed assessment of your respiratory function that's often done in specialist laboratories, usually in hospital, although you can do them in some community setups. And they look at how quickly you're able to get rid of air from your lungs, and they look at your lung capacity, and these give really useful information. And sometimes they may do something called a reversibility whilst you're having this spirometry done, so they may give you a medication and then repeat the test to see whether it significantly improves your lung capacity and lung function. Again, this will help to detect whether there's the reversibility or the hyperresponsiveness that I mentioned earlier. Now, making the diagnosis of asthma in children often is based on the history, so based on the questioning and what's been happening to the child and their response to treatment, because it can be very difficult for a child to be able to do this test and to be able to do it reliably, especially if the child is less than 5 years old. Often the diagnosis is made purely based on the history, listening to the child's chest, and making a clinical judgment of whether this is asthma and trialing treatment and checking the response after that. Now, how is asthma treated? Now, before going into specific treatments, let's talk about the aims of treatment. If someone has asthma, our aim is usually to ensure that you have no daytime symptoms, not woken up at night at all by your asthma, not requiring the use of your rescue inhaler, and I'll talk about what this is in a second, not being limited in your physical activity by asthma, not having any asthma attacks at all, and also not having any side effects from taking your asthma medication. It's worth bearing this in mind, so you're clear on what your doctor is trying to achieve when discussing your medication. Now, it would also be important to manage lifestyle measures that may trigger your asthma. So, for example, if you're overweight or obese, reducing your weight will help your asthma. If you're a smoker, stopping smoking will help your asthma. If you're a passive smoker, reducing your exposure to smoking will help your asthma. If you work in an environment where you're exposed to triggers of your asthma, such as flower painting or welding industry, as mentioned above, avoiding the environment or sometimes changing occupation might be what you need to do to help your asthma. Additionally, if you also have anxiety or depression, it's really important that we address it and manage it well if it's present. Now, ideally, before even being prescribed any medication, it's really important that you have your own personal peak flow meter and you have a personalized asthma management plan, so you know exactly what to do with your medication based on your symptoms or deterioration in your symptoms, and based on your peak flow readings as well. Now, let's talk about medications and the principles of medications. If you have asthma, you'll hear your medical practitioner talk about reliever medications, that's your blue salbutamol inhaler, and preventive medications, that's usually your steroid medication, but there are others as well. Now, Your reliever medication will only help to temporarily open up your airway. So let me show you what I mean. So if your airway was narrow like that and you take your reliever medication, it will help to temporarily open the airway. However, your reliever medication will do nothing to any inflammation that you have going on in your airway at all. So taking your preventer medication on a regular basis is really, really important, because that's actually what's treating the primary disease process, which is a chronic airway inflammation that's taking place in asthma. Now, the strength of your preventer medication, so your inhaled corticosteroid medication or your brown inhaler, will vary depending on the severity of your symptoms. And as I mentioned earlier, your asthma can sometimes be fairly stable, or it can be triggered to higher levels of severity. And your doctor will advise increasing the dose of your inhaled corticosteroid, or you may have the same prescription, but they may advise increasing how many puffs of it you take every single day. There are other medications that are added as part of the treatment of asthma that are not necessary for a video such as this, but your doctor will discuss these with you should they be necessary, depending on the severity of your symptoms. Features that would often indicate that your preventer medication needs to be increased would include, frequent use of your blue reliever inhaler. So, for example, needing to use it at least 3 or more times a week, or needing to use it at night at all would be indications that your preventer inhaler has to be increased, or that you need to review the technique of how you use it, so that you're ensuring that you get an adequate delivery of the inhaled corticosteroid into your lungs. These are really, really important. So your technique and how you use your inhaler will determine how much of the medication gets into your lung, and therefore how much of a response you can have. And so it's also vitally important that you get the technique right. So often we'll be repeating those steps with you and watching you use your inhalers, making sure that you're doing it in the right way. Sometimes we may also advise using something called a spacer device. So this is a chamber that you attach. You attach the end of the inhaler on one end of the chamber and a mouthpiece to your mouth, and then you press the inhaler, and you're going to, in a similar way as using your inhaler, coordinate the breathing. Or sometimes they may advise you to do something called tidal breathing. These are really difficult to explain in a video such as this without any prompts, but I mention them just because you may hear the terms, or you may be asked repeatedly about how you use your inhaler when you visit your physician. Because even if you were good 1 year ago, your technique can deteriorate, and it's important that you have the right technique all the time. Now, other medications that you may be asked to take, for example, if you have an asthma attack. If you have an asthma attack, you may be prescribed steroid tablets and something called prednisolone, for example, or sometimes you may require an admission to hospital where you may be given something called a nebulizer. So this is your reliever medication, delivered in a much more powerful and a much more effective way to have a very rapid effect in terms of opening up your airway if you're having a severe asthma attack. And when you have asthma, it's really important that you have at least an annual follow-up with your physician. For some people with severe symptoms, they may have more regular follow-up than that. It's also important that you have the annual flu vaccination to reduce your risk of a severe flu infection. If you're pregnant, the management of asthma is not different at all. The use of steroid inhalers are safe in pregnancy. And if a pregnant woman has a severe life-threatening asthma attack, then the use of nebulizers or steroid tablets, or sometimes in hospital they may give you steroid injections, may be necessary in order to ensure you don't deteriorate and protect you and your baby. So let me leave you with some self-help tips if you have asthma, or that you can share with someone you know who may have asthma. Importantly, avoid triggers. So know what triggers your asthma and avoid them. And sometimes it may be changing occupations. If you smoke, stop smoking. If you're a passive smoker, avoid exposure, or ask those around you to smoke outside of the house. If you're overweight, it's important to reduce your weight, especially if you have a very high BMI. That reduction can help your breathing and improve control of your asthma. It's also really important that you use your preventer on a daily, regular basis, not just when your asthma flares up, because it only works on reducing the inflammation in the airway if you use it on a regular basis. You don't usually get an instant relief in your breathing when you take your preventer. Some patients would often say, well, I use my brown inhaler and it does nothing to my breathing. But when I use my blue inhaler, I feel much better. But the thing is, if you don't use your preventer, your brown inhaler, you'll end up needing to use your blue inhaler all the time, and the inflammation will get worse and worse and worse, and that doesn't help your asthma at all. Finally, have a peak flow meter. If you don't have one, ask your doctor to prescribe one for you, and have a personalized asthma plan so you know exactly what to do when your asthma symptoms worsen and when your peak flow meter changes for the worse, so you know exactly what steps to take to stop you going on to develop a severe asthma attack. Thank you so much for getting to the end of this video. I really appreciate the time that you're investing in improving your health. Now, if there was anything that stood out for you, or on the other hand wasn't so clear, please feel free to send us a comment. And if you're watching this on our YouTube channel, please put a comment below. This might just trigger something for someone else. Your insights may just be what helps someone else who's watching this. Now remember, these are generalized advice. If you want a sort of personalized medical advice, please see your doctor. Whoever that doctor is, we at Doctor will be more than happy to have a private consultation with you, and you can book an appointment by following the instructions using the contact details that you can see on the page. Now, I wish you good health, longevity, better years ahead, and success in your journey to becoming master of your health. Thank you very much.